Alright, let's do a brief overview of second-generation antipsychotics. First, antipsychotics block dopamine. That's how they work for bipolar and schizophrenia, we think. That's the dopamine hypothesis. Dopamine blockade is to help with the positive symptoms of schizophrenia: delusions, hallucinations, disorganized thinking. First and second-generation antipsychotics both block dopamine. Second-generation antipsychotics are different because they block the serotonin 2A receptor, which is thought to help with negative symptoms of schizophrenia. Negative symptoms like blunted affect, avolition, alogia, anhedonia, and social withdrawal. Negative symptoms are harder to treat than positive symptoms. Second-generation antipsychotics typically have less EPS than first-generation, or extrapyramidal symptoms. This is dystonia, akathisia, Parkinsonism, tardive dyskinesia. Remember, this is less of a risk, not 0%. A lot of patients in second-generation antipsychotics still have EPS. They also generally have more metabolic effects, so increased blood sugar, blood glucose, weight gain. Alright, let's start with Clozaril, or clozapine. These images are from Stahl's Essential Psychopharmacology book. Clozaril is approved for treatment-resistant schizophrenia. This is when patients fail like 2 other therapies. And to my knowledge, it's the only antipsychotic that decreases the risk of suicide in patients with schizophrenia. It has 5 black box warnings. First is agranulocytosis or severe neutropenia. This is a severe decrease in neutrophils. This is a white blood cell. November of 2024, the FDA voted to remove the REMS program for Clozaril. A REMS program is a risk evaluation mitigation strategy. These are required by the FDA for drugs that carry serious risks. This is to monitor, manage, and prevent these risks. Another black box warning is seizures. Clozaril lowers the seizure threshold. Another black box warning is myocarditis and cardiomyopathy. Another black box is orthostatic hypotension, bradycardia, and syncope. This is a sudden drop in your blood pressure whether you get it from sitting or laying down. This is a slower heart rate, and this is fainting. And the last black box warning is the same thing with other antipsychotics: increased risk of mortality in elderly with dementia-related psychosis. This is usually due to cardiovascular events and then aspiration pneumonia. Although it has all those black box warnings, this is the gold standard for treatment refractory schizophrenia. It has a lot of side effects. You see a lot of sedation. That's due to its antihistamine activity. You see a lot of weight gain. There's a few different proposed mechanisms to why antipsychotics cause a lot of weight gain. One thing I'll mention is serotonin 2C receptor. This blocks that receptor. The drug that was taken off the market, Belviq or lorcaserin, in 2020 actually was an agonist on that receptor. It acted on 2C. It was a weight loss drug. We also see some dizziness and hypotension, as I mentioned earlier. This is because it's an alpha-1 blocker. It has high activity there too. Something interesting to note is this hypersalivation or sialuria. We think this is something to do with its activity or activation on M4 receptors. Important to note is that the constipation with Clozaril can be very severe. The mortality rate associated with GI hypomobility and constipation is actually higher than the mortality rate or Clozaril-induced agranulocytosis. We see constipation because it's highly anticholinergic. With this, abrupt withdrawal of Clozaril can cause cholinergic rebound. You can maybe see nausea, vomiting, diarrhea. Because of its side effect profile, you have to gradually titrate it or slowly increase your dose over an amount of time. If you miss your dose for more than 48 hours, it's recommended to restart that titration. Something to note is that it's metabolized by CYP1A2, 2D6, and 3A4. Smoking cigarettes can induce the metabolism of Clozaril. This is due to the chemicals in tobacco smoke, the polycyclic aromatic hydrocarbons, not because of the nicotine. Remember, enzyme inducers decrease the concentration of a drug, so this is going to decrease efficacy and increase the risk of therapeutic failure because, again, it's decreasing concentrations. Another thing is you generally want to avoid benzodiazepines in patients who are on Clozaril. This is because when you pair them together, it increases the risk of respiratory arrest. So to sum it up, very effective for schizophrenia, lots of side effects, high affinity for alpha-1, muscarinic receptors, and histamine receptors.